Doesn't make a whole lot of sense. What that does say is that dog has you trained. And then the last thing is denial, and that goes in with a lot of different things. Again, it's not my place or anybody's place to tell you you're in denial, to tell you you have an issue that's going deeper, but it is your place as the owner to look within yourself and ask, am I doing the right thing? Am I treating these dogs well? Am I treating these cats well? That's something that you've got to ultimately be okay with. So let's get into the risks. The risks involved with an overweight pet. Remember what we talked about, even 5 pounds is 25 pounds to us. So think about that. That's a big, big impact. Here are some risks involved. They are a high anesthetic risk. When your pet is overweight, and let's say your cat needs a dental or yearly dental, bi-yearly dental, or let's say your dog has a lipoma that they need removed, even if it's a quote-unquote routine surgery, which we know no surgery is routine, but if it is, and they need to go under anesthesia, they're going to be assessed as a high risk. We have an assessment chart that we use on certain patients, on on all patients, but we look at geriatric patients, we look at very neonatal or young patients, we look at severely traumatized patients, wounded patients, and obese patients. They fit into that high risk category. Anesthetic gas is metabolized and goes out through your lungs. It's oxygenated, goes out, in and out, in and out. When you have all of that extra weight, your blood is not going to be going as it should. A lot of things in your system, your organs are not going to be functioning as they should. Your liver, that takes a huge toll. Pancreas, a lot of things. So we become a high anesthetic risk. Next is heart disease. Just like with humans, your risk increases. Diabetes type 2. That's huge with cats, and we have seen some dogs with that now as well. And the sad part is when a cat, and I always say this to people who say, oh, cute, fat cats are cute. A diabetic cat needs injections every day. A diabetic cat goes through huge amounts of stress. That's not so cute when you're the person who A, has to pay for the insulin, B, has to pay for the syringes, and C, has to inject this cat every single day. That's not very cute. And worst case scenario, the cat may become insulin resistant because of weight. Next, pain, arthritis, and lameness. That's self-explanatory. There was a Doberman that a technician friend of mine would always tell the story about, and this Doberman was, X amount of pounds overweight. And she would come in growling, biting, snapping, and they couldn't figure it out. And finally, my girlfriend said, she's overweight. She is so painful. Getting her up to even go into the exam room, that enough, is too much. So once the owner started to get on a veterinarian-approved weight loss system, that dog was so not even recognizable the next couple of visits because she was happy. She felt okay. Next, heat intolerance. While brachycephalic breeds such as bulldogs, Persian cats, Himalayan cats, boxers, some pit bulls with real short faces, they do have heat intolerance. But their risk goes up, especially on brachycephalic animals who are overweight, because that's just adding to it. They've got that elongated palate, they've got the extra weight, they may have some sensitivities going on anyways, and then they've got the heat to deal with. And then, of course, any pet who's overweight is going to have that horrible heat intolerance as well. Lipomas and cancers. A veterinarian once said to me when I was first starting out, because I asked her, I said, why do lipomas happen? Lipomas are lumps of fat. So if you feel a lump on your dog or cat, always a good idea to go get that checked out at the veterinarian. Don't ever assume that it's okay. But if they come back as just a lipoma, a fatty tumor, why? What's the cause of that? What is the point of those really? And she said to me, if we knew that, we'd be rich. And also, it seems that overweight dogs tend to get these more pockets of fat depositing. And lipomas may not be cancerous, but they can grow and grow and grow and become real uncomfortable, start to press on other things as well in the body. And certain cancers, dogs and cats have a higher risk of getting these cancers if they are overweight. Pancreatitis is another big one. They have a higher risk for pancreatitis. We will go over pancreatitis when we talk about nutrition in our nutrition segment, or in our nutrition webinar. skin issues. Cats especially, we see acute chin acne and face acne on cats who are overweight, but you also have a poor quality of skin on dogs and cats who are overweight. When we do an exam, we look at the entire pet and we kind of assess, do they have bright clear eyes, or are their eyes kind of glassy or kind of cloudy? Is their coat looking really nicely shiny and primped the way it should, or is it kind of dull, dehydrated looking? And when we see overweight pets, a lot of times their coat just isn't the way it should be. High blood pressure is another one. That is a huge one. And a lot of times as well, it's not something that we can tell off the bat. So we do need blood pressure monitoring. And if your cat or dog develops high blood pressure and possibly medications are recommended or not, but something that may be recommended is blood pressure monitoring. So now we've got an overweight pet and we've got an inconvenience to you, because you have a job to start bringing your pet in to get monitored. That's a big inconvenience. Next is a decreased immune system, decreased immune function. Then we have abnormalities in the endocrine system function. Endocrine system is what we talked a little bit before about. Liver disease, the risk of that goes up. And of course, respiratory issues due to being overweight. So you're probably sitting here, if you have an overweight cat, an overweight dog, asking, well then what do? I have no idea what to do or how to get this pet thinner again. We talked about how a pet should have a waistline. You look at their rib cage, put your hands on either side of their rib cage. And I'll go ahead and I'll do a little segment on either one of my dogs or my mom's dog, and I will show you what I'm talking about in terms of putting your hands on either side of the rib cage and seeing that waistline. So you put your hands on either side of the rib cage. And this is to determine, are we overweight or not? If you can press lightly and feel their ribs by pressing in a little bit, perfect. You should not be able to see the ribs. You should not be able to have to dig for them as either. They should be at a 3. Before you do anything, before you go and get a weight loss food or a weight control food, before you start running your dog, which is never a good idea, because remember, if they're painful, if they have respiratory issues, we don't want to push that exercise. But you should always talk to your veterinarian first. That's a really important thing. Just like as recommended for humans, talk to your doctor before going on a weight loss regimen. We want to rule out any health-related weight issues. Remember, Cushing's, hypothyroidism, those were some possibilities. So we want to talk to our vet to rule out things like that. And we also want to make sure that our pet hasn't developed any cancers or liver disease as a result of being overweight. So always start with your veterinarian first, no matter what. They will probably put your pet on a weight-controlled food. Science Diet, Hill's Science Diet, makes a wonderful weight-control food. There's a few of them out there. And it's a prescription only, but it's great because it is formulated together so that everything just kind of goes into it. If you've ever wondered, well, why is it KD? Why is it, JD? Why is it BD? Those are the enzymes. Those are certain proteins that scientists have linked and chained together to go into the pet system and fit in such a way that the body recognizes it and it does its function. Another food, let's see, that's a good one. I don't know if you guys can see that, but it's Purina, and it's a veterinary diet. Now, I normally would never recommend Purina. That's just not me. However, when it comes to an issue, a prescription food, I will never tell somebody not to go with this. Even if they are like, well, I only do the natural stuff. Why would I go and get Purina or Science Diet? When it comes down to your pet's health, stop being pretentious for 2 seconds and do what you need to do. Let's just put that up a little bit so you can see that. Okay. So we've got OM, LM, and let's see, that's right here. Cute little picture of the bulldog. So I just wanted to show you guys that to get a picture of that. And then there's also, like I said, the Hill's Science Diet. And again, you cannot prescribe this. You cannot get this on your own. Your veterinarian has to assess your pet and make sure that it's an all right food. Next, exercises. Some clients will say to me, well, should I go home and take my dog jogging every night? Should I, have my cat do the laser mouse thing every night for a good hour?